Hi, my name is Ita. Today I'll be presenting my e-resource which is based on the topic called women. Who are called women? CALD is an acronym that means culturally and linguistically diverse, the term specifically used in Australia to describe individuals or groups from different cultural, linguistic, and religious backgrounds. These are women born overseas who are migrants, asylum seekers, refugees, or from a non-English speaking background. Globally, Australia is among the countries that has the most culturally and linguistically diverse population, where 51.5% of Australian population was born overseas. Western Australia comprised of 24.4% of all population as per the Office of Multicultural Interest and is still increasing as per them. Social determinants and antecedents these population face. So communication barrier. Many of the card women come from a non-English speaking background. The language barrier hinders communication, resulting in poor rapport, inability to understand medical advice, and it decreases participation in one's own pregnancy-related care throughout the antenatal, intrapartum, and postnatal period. Socially isolated. Hailing from a different country, card women are away from immediate or extended family with minimal support. Due to this factor, these women experience heightened stress and are at a higher risk of mental health challenges during their pregnancy. Socioeconomic limitation. In Australia, Medicare is only limited to permanent resident and Australian citizens. As they lack sufficient health insurance and funds due to financial stress, they are unable to incur the cost, which leads to missed appointments and avoiding the system. Other socioeconomic factors include lack of transportation, parking costs, work time constraints, etc. Culturally insensitivity. Culturally diverse populations have their beliefs and practices that they practice in their pregnancy, labor, and postnatal care. The current maternity system still works on the Western biomedical care, which dominates midwives' ability to provide culturally appropriate care. Navigating the healthcare system. According to a report on Western Sydney, card women find the Western healthcare system complex and difficult to understand and navigate around. Therefore, they experience hurdles in accessing care, making appointments, and exploring other options. Challenges they face to accessing care. Delayed antenatal care. Card women have limited independence where attendance and transportation is dependent on their partner's availability. This can delay antenatal care and reduce engagement between the woman and midwife. Communication barriers. Most card women belong from a non-English background. It affects the exchange of conversation, interchange of information, accuracy, and accessing resources. Lack of understanding. Information and medical advice is poorly understood, which affects self-management, missed screening, and reduce adherence to treatment. Fear. This can stem from previous perceived discrimination, negative exposure, and an unknown system can lead to fear of healthcare workers and the system. Financial constraints. Recent immigrants or refugees may experience financial difficulties. It may put women in a position to prioritize immediate needs. Impact on pregnancy and birth. A study on CALD women in Sydney showed CALD women were at a higher risk to experience antenatal distress and depression due to low support, domestic violence, and fear of racial stigma. Low health literacy and communication failure puts these women at a higher risk of obstructive interventions because of compromised decision making, understanding, and consent. Research demonstrates that the CARD population is at a higher risk of induction and C-sections. Language barriers can limit the understanding of medical education, which can delay care or access to appointments when they are not acquainted with the healthcare system. Education and consent is compromised when partners are relied on to facilitate communication rather than professional interpreters, which impacts accuracy which impacts accuracy, confidentiality, and consent. The fetus are at an increased risk of preterm birth, low birth weight, difficulties with breastfeeding support, or stillbirth. So services. In services, we'll explore which services cardamom would benefit from. So midwifery group practice MGP is a specialized clinic that cater women from a card background. It aims to is to provide continuity of care, culturally safe care to improve maternal outcomes. Hospitals like Armadale have a dedicated CALD clinic which aims to provide appropriate care and relevant education in the desired language. Interpreter services will help in removing language barriers which will improve engagement, communication, and increase satisfaction. This service can be accessed through phone, video, and in person. Perinatal Anxiety and Depression Australia (PANDA) is an online free service that supports pregnant women and families with perinatal mental health. They are accessible through phone and provide online health resources in different languages for both women and healthcare workers. Refugee clinics. They are based in the community, providing specialized, culturally sensitive care to women, supporting their needs and help to refugees and asylum seekers. For example, Ishar, based in WA, provides holistic care, education, and clinical care for women during the antenatal, intrapartum, and postnatal period. Lactation consultants. They are midwives that provide breastfeeding support to women with feeding positions, latch, milk supply, mastitis, and etc. King Edward's Memorial Hospital has a breastfeeding center that sees women as outpatient or telehealth as per the requirement to help them with breastfeeding issues later on in the community. Child health nurse. They are trained nurses in child and family health and takes over baby's care after birth in the community. Midwife's role. Midwives as first point of contact maintain relationships with women throughout the perinatal period, fostering trust, rapport, and encouraging open dialogue. Culturally safe care. As Nursing and Midwifery Board of Australia standards of practice, midwife practice needs to be enriched in cultural awareness and safety to foster trust, respectful and respectful practice that is safe. Communication and interpreter. Clear communication is important as it enables exchange of information, builds trust, informed consent, and improves maternal satisfaction. Utilizing trained interpreters increase women's understanding of care and options available. Continuity of care (COC). Implementing CARD COC program will allow engagement with the same midwife, making them feel more supported, satisfied with care, and have more trust with their midwife. Advocacy. CARD women experience many barriers. Advocacy is midwife's duty, so women are heard, their choices are respected, they feel supported, and and this will help support their decision making, ensuring safe care. Safety screening. CARD women are at an increased risk of domestic violence from partners in antenatal and postpartum period. So safety screening is very important so we know if a woman is going through this in sensitive time frame. Guidelines and resources available. Nursing and Midwifery Board of Australia Standards for Practice focuses and promotes women-centered care, culturally enriched practice, respectful partnership, advocacy, and evidence-based practice. These standards are a guide for midwife to provide strong, culturally safe care to women. However, while these standards are strong, but there is inconsistency in practice such as organization barriers, stereotyping, and various level of cultural awareness. Australian College of Midwives promotes culturally responsive care, continuity of care models, and care that is woman-centered. COC has shown promising results but is a small group with limited availability. Specialized services are limited to women in a specific geographical diameter. High demand and shortage of midwives make sustainability of this practice difficult. King Edward's Memorial Hospital is an open resource platform for both women and midwives. Midwives can access policies to follow an evidence supported pathway and it guides midwife when and who to escalate to. Health translations by Victorian government has resources translated in different languages to empower women with health literacy, informed decision making. Multicultural Health Services directory is for staff members that has all the programs that are relevant for individuals of CALD background. The directory also tells which area the program is local to. However, referrals can get delayed due to waiting time frames or get lost in the system. This puts the woman at a disadvantage as she has to wait and follow up with the midwife at the next available appointment that she's going to see her. And that is all. Thank you for watching.